invested in you.
The following program is sponsored by the Medicine Center Pharmacies. Your line is open.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist. We are glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices and wish our friends at WHBC and our listening audience continued good health. Our guest today is Shannon Urena, physician assistant from Aultman Medical Group Plastic Surgery. Shannon, welcome to the show. Thanks for joining us. Looking forward to talking with you today.
All right. Have you ever wondered about the term plastic surgery? The term plastic surgery comes from Greek language and literally means reshaping or remodeling from original flesh. Plastic surgery is a surgical specialty involving the restoration, reconstruction, or alteration of the human body. It can be divided into two main categories: reconstructive surgery and cosmetic surgery. Today, we welcome Shannon Urena from Aultman Medical Group Plastic Surgery, and we'll be discussing different types of plastic surgery. We'd like to remind our listeners that our program is available on our podcast, and you can go to your favorite podcast app and download Health Matters with the Medicine Center Pharmacy and enjoy all our programs. So please subscribe.
So Shannon, welcome to the show. Tell us a little bit about yourself.
First off, thank you so much for having me on your show. A little bit about myself is I was raised on the East Coast. I moved out to Ohio about a year ago. So as you can imagine, I've been used to a very big city, New York City. However, it's been a great change of pace, to be honest with you. My background first started in medicine as I was very, very young. My mother has lupus, so that's an autoimmune disease, and I was in and out of doctor's offices with her, so I innately gravitated towards medicine. I always wanted to know why certain decisions were being made, so I dedicated myself to biology and chemistry on my undergraduate studies. I invested many hours working after that in dermatology, reconstructive plastics, general vascular and breast surgery. Then after I gained more experience, I then went on to my graduate level degree, and now I'm working for Aultman Plastic Surgery.
So where'd you do all your training? All in New Jersey, or?
The majority of my graduate level, yes, I did in New Jersey. I did my undergraduate studies at a university called Holy Family in Philadelphia, Pennsylvania. And shortly after, I did an accelerated year of human biology at Chatham University in Pittsburgh. And my final grad degree was in Rutgers, New Jersey. So I've kind of been all over the place, but that was my final spot. When
my staff heard that we were going to have someone on the program today from a plastic surgery practice, she was wondering, one of the pharmacists was wondering if you'd be handing out any coupons today.
Ah, very funny. I wish.
I looked at her and I said, "You got to be kidding." I said, but anyway, I thought that was kind of humorous. So, what all did your training involve, and how did you get here? I mean, coming from New Jersey to Canton, Ohio, had to be, as you said, a huge cultural shock, because here you are across the street from where you work. Okay, you're gonna walk across the street and maybe wait for a few minutes to get across the street, but not very long. So.
Right. Well, I'll first answer what my training involved, and then I'll touch base on, why I'm out in Ohio. So,
I mean, not that Ohio's bad. I just
No, it's actually been great. Honestly, there's barely a lot of traffic as to, what I'm typically used to. It takes an hour to get to where you want to be. So that's been wonderful. Honestly, I wouldn't want it any other way. So in terms of my training experience for becoming a PA, that typically entails anywhere from 6 to 8 years of college. So you would have to do 4 years of undergrad and then train in a PA program, 2 to 3 years, depending on the university. That includes didactic year of where you're in the classroom, and then anywhere from 1.5 to 2 years of clinicals. So you're in the hospitals, you're working with patients and working like that until you pass your boards.
So what is your role in the plastic practice?
So as a PA in the office, you can examine, treat, diagnose patients. We do a lot of procedures in the office as well. In terms of the OR, we do a lot of first assisting with our surgeon, and basically whenever we are in the office, we are seeing the patients, whether they are initial new patient versus a post-op patient where you're evaluating them after surgery. So that's what that entails a lot of the time.
So I'm told you'll be doing surgery today. What do you normally do?
Okay. So prior to the surgery, there's a pre-op holding area, and that's where the patient is getting ready and prepped for the OR. There's several different teams like anesthesia that sees them prior to, the plastic surgery team sees them, so myself and Dr. Lopez, and we kind of review with the patient what they're having done. We mark the patient, so I help Dr. Lopez, who's my colleague, mark the patient and kind of just prepare them right before they come into the intra-op area, which is the operating suite. Then I first assist in a lot of cases, which means anywhere from just making the operation go more smoother for him. If I need to hold a piece of skin and fat and manipulate tissue, I'm there doing that while he's maybe cauterizing or stopping a blood vessel. And so am I. So I'm a second pair of eyes for him and hands. Also closing cases where we're suturing together. I always make sure things are running smoothly before and after, making sure the patients have all their prescriptions ready. Post-operatively, we see after the surgery is over, we bring the patient to the PACU, which is the holding area, whether or not they're going to get discharged. We kind of follow them there. We talk with the patient's family members too, and we kind of let them know how the patient did during the surgery and what was done and what to expect in this post-op period.
So one quick thing, maybe off the subject. I had an older sister who's no longer with us, but she had strawberry birthmarks on her face.
Mm-hmm.
They tried everything to remove those. This was back in the primitive days. Okay.
Mm-hmm.
Do you encounter those?
Yes, we do. We encounter a lot of skin conditions, especially like this with birthmarks. And a lot of times too, you can find them on children's neck lines called stork bite in a lot of ways. And there are certain lasers that basically attract itself to the red pigment, and it causes thermal damage to the red pigment of the skin, and essentially forms a new layer of epidermis. and can help in that way. So there are a lot of lasers in the aesthetic industry that can help with that.
Very interesting. Okay, it's time for our first break to listen to Health Matters with the Medicine Center Pharmacy.
Louisville, Minerva, and New Philadelphia. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Shannon, Urena, physician assistant from Aultman Medical Group Plastic Surgery. I have a question posted on our live Facebook feed. I guess we should move on to you, Brad.
All right. So you mentioned some of your role with Dr. Lopez when you assist in the practice. And you mentioned also before our break, you talked about some lasers, and it sounds like you've had some experience working with those. Do you have any other comments that you'd like to share about the technology you can use in your practice?
So right now in the OR, we operate the CO2 laser, which is a fractional laser. Essentially, what that does is it works superficially on the epidermis and the dermis layer of the skin. And so it can cause thermal damage to those layers. And so essentially it scabs over in a couple of days and falls off, depending on what it is. But it has a lot of functionality to it in terms of precancerous lesions, something we call actinic keratosis. We can use that on to cause that damage and make it stimulate more collagen in that area. Also for any acne scarring, we can use that, skin tightening, skin wrinkles of the face, the neck, which we get as we age. And so that's a very exciting laser that we are using in the OR.
Interesting. I guess when I think of plastic surgery, I often think of a lot of invasive surgeries like incisions and reconstruction and things. So that sounds like more of a non-invasive procedure. Would that be accurate, or?
Correct. Okay. That's more non-invasive, to be honest, rather than invasive. And there are many lasers in the aesthetic industry, whether they're light or they're operated by microneedles. So those are less invasive than the more invasive kind of procedures where you're cutting into skin and doing tissue manipulation.
Okay. So let's talk about Botox. Botox continues to be an interesting subject. And it's been brought to my attention that there are non-plastic surgeons that are using Botox in their practice. And I wondered if you could comment on the safety of Botox and what's important to know when you're working with it for patients.
Yes. So the aesthetic industry is very large, and a lot of people are trying to get into it. It's actually trending. So if you were to ask me if somebody who was not in the specialty is doing this, it is concerning because they don't typically work with this every day or have had years of experience in it. A lot of times I have heard colleagues mention that general practitioners or perhaps people in a specialty where it's just family medicine, tend to take maybe a week course or a weekend course. And unfortunately, that's just not enough of time to prepare yourself for this kind of work. You really need to know the muscle anatomy, where your elevators are, where your depressors are, meaning what pulls the face, what, where the muscles are structured. And especially to the arteries of the face. You can cause tissue necrosis if you would occlude an artery, and so it doesn't perfuse so it's just a lot of things you have to be prepared for. Now, I will say there are some other specialties that have a lot of facial anatomy experience, which would be ophthalmology. I know some ophthalmologists do Botox injections. I've heard of dentists doing Botox injections. And dermatology practitioners. And so, yes, I do believe it does have some wiggle room for those that have a lot of experience in skin or facial anatomy. I think that that's okay.
So I get the impression that the depth of the injection and the placement of those injections are critical.
Correct. Yes.
Okay. What does Botox do?
Botox is a neuromodulator, so it functions at the synapse of acetylcholine, and so it prevents the synapse from happening. And so a lot of people think, oh, I'm going to get Botox, I'm going to tighten my face. And in fact, it's the opposite. It actually relaxes the muscle. So that's essentially what it's doing. It's relaxing the muscle so you don't have high tension of that muscle functioning and it causing a wrinkle.
So the uses in the ophthalmologist and the dentist, what is the advantage to that?
It's interesting that you ask. Honestly, I think a lot of practitioners have gone into it because it allows them more versatility in their practice, kind of opens other avenues and doors for their practice essentially. So it's not that they can't do it, it's more so opening other doors for different kinds of patients, or perhaps patients have asked them and they have decided to get into it. They have the facial anatomy, so why not?
So not the dentist would not use it for dental pain or anything. Is that accurate, or is it totally different?
No, they wouldn't use it for pain.
I guess I've never understood why a toxin could be advantageous in surgical techniques. Okay.
I hear you, Matt. That's why I don't like to call it a toxin really. When I explain this to patients, I like to describe it as a neuromodulator because in reality, Botox being a toxin, yes, that is correct. It takes a lot of toxin to cause botulism essentially to the patient. So, it takes a higher dose to have that happen. And it's micro aliquots of units that we use in certain muscles. So we ensure that would never.
So that's the secret of the product, and not using large amounts of it.
Correct.
Injecting in the face or wherever you do happen to inject it.
Right.
Huh, interesting. I suppose we should take a break here, huh, Brett?
Yep, time for the news.
It's about on the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
BC. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
So you are listening to Health Matters with the Medicine Center Pharmacy, and I'm your host and pharmacist, Paul White. Today, Brad and I are discussing plastic surgery. We've got a lot more to cover this morning, so let's get back to the show.
So Shannon, let's talk about surgical tourism and maybe in the past what that meant and maybe what it means now with the coronavirus so prevalent.
Mm-hmm. So I understand that surgical tourism has become very popular for several reasons. One, it may be cheaper for some patients to afford perhaps in other countries. and easier for them to attain, or they may be able to get in sooner rather than a plastic surgeon in the area. And so that is obviously very attractive. You know, patients, we live in a society where patients want things immediately. Doesn't always happen, but you know, my biggest concern with this is that patients really need to do their due diligence of finding out whether or not these surgeons are board certified, especially in their field, whether they're plastic surgeons or facial plastic surgeons, or if they've had extensive time working with these kinds of procedures. I would recommend always asking, hey, you know, do you have a before and after picture? How many times have you done this procedure? Just really knowing, because this is something they're paying for and this is on their body. My next concern, I'll be quite honest with you, is that if they go overseas or if they go to a different country, there is not a lot of follow-up afterwards. You know, patients will go and then that's it. They have the procedure done, they're happy, but there's no following up and how those incision sites are doing, or, you know, so, and then we get them in the United States and we have to deal with those complications. So, you know, it's a battle. I'm not saying that, I'm sure there are a lot of countries that do a great job, but that is a concern.
What you're saying is that there's probably idiosyncrasies in every sort of surgery, and you don't really get you don't get all the information when they come back to America.
Right.
So you got to kind of guess at what they did and how they did it, and you know, did they have complications, and on, you know.
Right. Exactly.
So I had a friend who had a heart bypass surgery in India.
Wow.
And came back and had some complications. They didn't really know exactly how or what they did, you know, to bypass his arteries. So they ended up going through more here.
Wow. Mm-hmm.
Interesting. So tell me about discounts in the Brilliant Distinction Program. How does it work?
Yes. So Brilliant Distinctions is a program that is offered through Allergan, which Allergan is a big aesthetic company that we purchase our Botox and fillers from. And essentially you can sign up online or you can sign up through their app. It's simply called Brilliant Distinctions. And at checkout, most patients are aware of it already. If they've had Botox or filler in the past, I just make sure to let my patients know, hey, make sure you sign up for your Brilliant Distinctions and you can earn points. So for every 100 points you receive.
Those are the coupons I asked about.
Ah, there you go. Yeah. Yes. So every 100 points, you get $10 off.
Interesting. Now, are they the only producer of Botox products?
No, there is some other companies. Another big one is called Galderma. So they supply a different form of Botox, which is essentially called Dysport. So there's different variations, but yes, there are other companies.
It seems to me that I remember Allergan as being the company that makes a lot of topical makeups and covers and things like that. Is that correct or not? There's Allergan.
So Allergan has Skin Medica, which is their skin products and their line that they have. We do not currently have this in the office, but we are looking into it because we are still fairly new. But yes, they do have some skincare products.
So if a person received Botox and earned points through the reward program, can they apply this to facial procedures with your practice?
Yes. So if the person received Botox and earn points in their first visit through the reward program, and they come back, they can use that reward for a facial filler. So yes, it can be applied.
Okay, here's the big question. What about men? Do they get cosmetic surgery?
Yes, they do. We call it Botox.
Call it what?
Botox.
Oh, okay.
So, I have seen men come in and get Botox, but yes, they do get it. The caveat to that is, again, a man's muscle structure in their face is much different than a female's muscle structure. Not saying they have different muscles, but as we've learned through anatomy courses, they typically have thicker muscles, bigger muscles. They have deeper lines in their face. So we have to use some more than females. We have to use more Botox units. And where we place the Botox is a little bit different, because you don't want to raise a man's eyebrows to look feminine. We want to keep it still, for them, very manly.
Well, what's the ratio of men to women?
To be honest with you, I don't have an exact ratio. I will say there is more females than males. I think males are a little bit more shy to come in, or there's a stigma against males getting work done. But I mean, they get it too. So,
what do they get done? What does a man face facially? Okay, what do a man do?
I don't really see too much. I've seen men get blepharoplasties. That's more surgical, obviously a little bit more invasive, where there's extra skin from their eyelids, and so there's not a big difference, in terms of when they come out from surgery. It's more of a facial rejuvenation. It's not like they're completely different. They look 50 years younger. So expectations have to be, discussed too. But yeah, blepharoplasties, Botox. To be honest, there's not a lot of males I have seen in my job that have gotten fillers. So.
What about facelifts? Years ago, we used to stitches all around the side and, near the hairline, pull the skin back, da-da-da. What's the technique that replaces that now? Or are we still doing that?
Right. We are still doing that. A lot of the times, and again, there's a lot of techniques out there that people are, advertising non-invasive facelifts. I understand in our industry we have radio frequency handles, essentially, that penetrate the skin superficially, and it tightens the skin while also basically pulls back the skin. But we currently do not have that now. It's still fairly new. There's a lot of evidence-based medicine on it, research being done, so that physicians can start doing them essentially even in the office. But right now we are just doing them under general anesthesia in the operating room. There are incision lines. They essentially are fairly close to the ear, so you don't really see them. Sometimes even with a vertical neck lift, there's tiny incision line underneath, but barely visible. So, there's so much out there, but yes, the typical facelift is still being utilized.
Okay, And for our final break, you're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White.
Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, we're talking with Shannon Urena. Do I pronounce your name right after this entire show? Am I correct?
Yes, it's Urena. However,
should have corrected me early. Okay. Anyway, you're listening to Health Matters with the Medicine Center Pharmacy. Our final segment is here.
All right. Are there any trending procedures among men and women right now?
Yes. So what I have seen in practice is men will typically err on the side of getting Botox and hair restoration. So that's what I've seen. Females, I've seen more filler use.
Do you do hair restoration?
At this time, no, but I can go over it if you'd like.
It's okay. I'm just curious because I know somebody who just had the plugs, but he says it's quite painful.
Oh, yeah. So if you're talking about the plugs, that's more of a hair transplantation. That's like very specific part of plastic surgery. Less invasive is something called PRP. And long story short, we essentially take your own blood and we would spin it in a centrifuge and use, we call it liquid gold, whatever is left from that centrifuge at the bottom, which is yellow in color, has special rich properties to it to stimulate hair growth. So.
Wow, interesting. Why does it work?
Huh?
Why does it work?
Why does it work?
Yeah.
Well, the thing is that it takes time for it to work. So a lot of people are not a fan of it, or we live in a very we need things immediately.
Fix it now, yeah, right.
So it does work. It does take time, though. There is a lot of, again, evidence-based medicine that has shown it to stimulate hair follicle growth, which is very interesting, but takes time, and a lot of people are not completely crazy about it.
Do you have an operating room at your office?
Yes, I do. We have a procedure room.
Okay. All right. So the next $1 million question is do you watch the TV show Botched?
Who hasn't watched the TV show Botched?
I haven't.
Oh, okay.
I don't even know what it's. I guess I've seen it advertised or something, but I've never. I take that this is botched surgeries, or what are we talking about here?
Yes. Yeah. So essentially, people have gotten plastic surgery done, and there have been complications with that particular surgery, and they've needed to have somebody fix the problem, hence the word botched. And then these two doctors fix the problem.
Dr. Oz, huh?
Well, Dr. Nassif is one of them. Actually, I've met him from afar, across the room at a conference once. But yes, he's one of them that does a lot of the botched procedures.
I figure you've seen people that you've had to, shall we say, fix.
Yes.
Bad, good,
Yeah. I mean, when you're in this industry, you see the good, you see the bad, and that's kind of why I've mentioned, making sure patients are doing their due diligence about, information. Who are they going to? Do they have enough expertise in the area? How long have they been practicing for? And,
Are most of these things correctable, or that you've seen or not?
My answer to that is it depends how extensive. Most times I would like to say yes. It truly depends on what they need fixed. For example, how much damage is there? What am I left to work with? Is there enough tissue? Is there enough cartilage or skin? Sometimes tissue dies off when people have these complications, and we're kind of left with sometimes not enough, and we need to think outside the box. Yes, a lot of times we do, but we also have to err on the side of what can we work with.
So do you use skin from other areas to, say, patch up something like this on the face or other parts of the body?
Yes, we have used skin from other areas, skin grafts, especially with people who, if we need to excise something, whether it's medically necessary versus a cosmetic situation, we have used skin. We've even used something called Integra, which is essentially a skin graft that is made in the lab and takes a little longer to heal, but it heals nicely.
See many burns?
Not too many burns, actually. Not too many, but they are not always easy to work with.
I recall some time ago seeing that they took skin from another part of the body for the burns and would not shred it, just like punch a bunch of holes in it so you could make a small piece of skin a lot larger, and then it would actually grow back together. Is that something that's used still?
Yes. So what you're talking about is something called a dermatome, and that's used in our operating room, and we harvest that particular skin, for example, from the thigh. And you kind of just scan over with the dermatome, and it peels off this tiny layer of skin superficially. You roll it through a device that makes tiny little holes, and then you place that skin on top of where you need it to be.
Go ahead, Brett.
Okay. So do you think people have do they always have realistic expectations of what's possible based on what you can accomplish?
Most of the times, yes. The expectations are discussed prior to the procedure, unless there's something else going on. There's something called body dysmorphia, where somebody is obsessed or focused on a minor flaw in appearance, and no matter how many times it's addressed, they're very fixated on it, and they constantly need it to be changed. And, unfortunately that's very sad. But most of the times, yes, expectations are met, and we discuss what to expect. Healing process takes a long time, anywhere from 3 to 6 months after postoperatively, depending on what they're having. So we are very transparent about that.
Okay. Do you need a referral to come see a plastic surgeon?
Most of the times, we get referrals from a lot of dermatologists to see patients for skin excisions. We get patients from breast surgeons who we work closely together with for breast reconstruction. So yes, a lot of the times no to on the cosmetic end, depending on whether or not this is going to go through insurance. It depends what kind of insurance you have. A lot of times, you need referrals depending on your insurance company. So it's always changing.
Can you leave your contact information with our listeners for Aultman Medical Group in your practice?
Yes, you can find us on our website at www.aultmanmedicalgroup.com. You can also call the office at 330-499-2209.
All right. Any parting comments before we break?
I guess I would just like to say that I truly love what I do. I'm very passionate about it. I hope the viewers were able to learn something about a PA and about plastic surgery, and I hope to see you guys soon.
Thank you.
I think we're out of time, aren't we?
Yep.
Shannon, we enjoyed talking to you today very much.
I enjoyed talking with you.
I don't think we've had this subject on the program. We've been on the air for 8 or 9 years, by the way. So
oh, wow. That's great.
we've had about every practice you can imagine. So, but thanks very much for appearing today from Aultman Medical Group Plastic Surgery. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis. As always, thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here next Friday on News Talk 1480 WHBC. Thanks again.
Thank you.
Thank you so much.